Using exercise to improve outcomes in people with a history of mild traumatic brain injury. The population to consider in this case is individuals with a history of mild traumatic brain injury. Most studies focus on women, athletes, and adolescents. However, researchers are suggesting the results can be applied to all individuals struggling with concussion symptoms. But why does motor performance matter? Motor performance is critical when it comes to diagnosis and recovery markers. Things like exercise intolerance and problems with balance are key indicators of the state of repair the brain is in. Alongside the diagnosis, motor performance also acts as a mechanism of recovery via neuroplasticity and progressive overload. The wide-known treatment of concussion until fairly recently has been what we call the cocoon method. Essentially, as an individual recovering from a concussion, you're supposed to focus on pure rest until you're fully asymptomatic. This was based on the discovery of a sensitive period in the brain for 24 to 48 hours following the time of impact. It was revealed in the source material that this method is unfounded, as there's nothing to support the use of excessive rest. In fact, studies are showing that too much rest can cause more harm when it comes to recovery long term. Some of the key motor challenges faced by concussed individuals are exercise intolerance, balance and postural instability, fatigability, perception action deficits, impaired coordination, and dual task deficits. Some of the key constraints they face in improving these deficits are symptom thresholds, dysregulation of the nervous system, a lower sensitivity to carbon dioxide leading to hypoventilation, heart rate variability, a window of sensitivity, and higher cerebral blood flow disproportionate to the level of exercise. The most important motor learning principles involved in concussion are augmented feedback and self-regulation, which is the use of real-time feedback such as HR monitors and the Borg RPE scale to manage symptom thresholds and track your progress. Progressive overload, which is the incremental increase of load over time, and specificity of training, which is training specific to the demands of the injury and individuality of the patient. How exactly are these principles involved? Well, augmented feedback allows the patient to better understand their physiological limits and regulate intensity levels. Gradual progression allows time for physiological adaptation. Specificity, in this case, aerobic exercise, targets deficiencies found in concussed brains, allowing for neuroplasticity to occur. Now, how does that relate to the constraints of a concussed individual? Well, self regulation is necessary to train under the symptom limited threshold, minimizing impact of cerebral blood flow and ANS dysfunction. The gradual increase in load over time accounts for the window of vulnerability by maintaining levels at a sub-threshold dosage, and specificity addresses exercise intolerance by encouraging neuroplasticity. The first major conclusion I drew from the source material was that the cocoon method is outdated and can actually delay your recovery. This is supported by a randomized controlled trial that showed patients following a strict rest protocol reported more daily symptoms and showed a slower rate of recovery. Another aspect of rest mentioned in the material was the impact of physical deconditioning on the individual's mental health. A decline in functionality and lack of participation in normal activities can be detrimental to athletes, especially who rely on their bodies to succeed. The second conclusion I drew from the material was that early intervention with exercise can be most beneficial towards system regulation. In a large prospective study of over 3,000 children, it showed that those who participated in early active recovery had a significantly reduced risk of developing long-term concussion symptoms. That same randomized control trial showed that participants following the strict rest regimen experienced a significantly reduced rate in the presence of long-term symptoms as well. It was also found that the use of the BCTT within the first week of injury is the greatest predictor of delayed recovery. The third conclusion I was able to draw from the material was that sub-threshold activity is shown to regulate body processes and encourage neuroplasticity. Kurowski et al. Compared subthreshold aerobic training to a placebo program involving stretching, finding greater results in the subthreshold group. Performing at 80 to 90% of max heart rate has shown to regulate CO2 sensitivity, ventilation during exercise, and aid in CBF regulation. By inducing BDNF, aerobic exercise promotes neuroplasticity. The fourth and final conclusion I drew from the articles was that progressive physical and cognitive overload allows for safe management of recovery. The recommendation based on studies are to respect the 24 to 48 hour window of sensitivity, followed by a slow and gradual return to social, cognitive, and physical load. Abrupt increases in load have been shown to spike symptoms for up to a period of 24 hours. However, overall evidence supports the use of progressive overload, allowing for slow adaptation to stress on the body. The Graded Progressive Exertion Test is a new motor test to aid in the recovery of concussion patients that I designed. The patient will complete 5 2 to 3 minute stages, increasing the difficulty of the task at each stage. Symptoms will be monitored using the numerical rating scale and the Borg rating of perceived exertion. The patient will stop if symptoms increase too rapidly or perceived exertion gets too high. Conducting the test. In stage 1, the patient is going to start with just a light walk on a flat surface. Then in stage 2, the patient will walk lightly while turning their head from left to right. This will add vestibular load. In stage 3, the patient will walk while counting upwards by threes, adding cognitive load. And in stage 4, the patient will walk while changing direction at each cone placed in a triangle formation. Stage 5, the patient will walk at a faster pace while tossing an object like a ball between their hands. If the patient tolerates up to stage 5, the test can repeat at a higher intensity. But why this test? Variable practice. Adding different tasks improves adaptability and has a real-world application. Progressive overload. By slowly increasing intensity, we can safely increase load tolerance in all areas rather than just cardio. And dual task training. Combining physical load with cognitive load gives us a better representation of all the areas impacted by the concussion. Now, I want to keep in mind that the test gathers information on load tolerance to be used in coordination with a recovery program, and it's to be done at least once a week. So, what are some expected changes to occur while completing the test? An increase in exercise tolerance. The patient should be able to reach higher stages progressively before symptoms arise. Improved dual task function. The patient should have fewer errors and greater success in dual task movements. Improved balance and movement. The patient should experience less stumbles and smoother automatic movement. Reduction in symptom severity, lower levels of symptoms during the test, and faster recovery post-exertion. And symptoms will be monitored using the NRS scale and the Borg scale. Lower scores are associated with improvement, and the clinician will track the highest stage completed and efficiency in the movement. Improvement will look like fewer mistakes and higher stage completion. In summary, individuals with a history of concussion often struggle with exercise intolerance, impaired balance, headaches, nausea, and dysfunction in dual task movements. Evidence from these studies involving the BCTT suggested that controlled progressive aerobic load is shown to improve symptoms and speed up return to play in athletes compared to the standard intervention of prolonged rest. The new approach, as previously discussed, targets all the symptoms involved in dysfunction due to concussion. It also applies motor principles such as progressive overload and variable practice to improve neuroplasticity, exercise tolerance, and coordination. The key takeaway for me was that the previous recommendation of rest until asymptomatic was misled. Controlled progressive overload better encourages neuroplasticity in damaged areas of the brain, allowing for faster relief of symptoms and greater exercise tolerance.